Welcome back. Today, Premier Moe and Dr. Shahab revealed a 5-phase plan to reopen Saskatchewan. In it, there's a lot of detail. There were also a lot of unknowns. What does all this mean from a medical perspective? We're joined now by Dr. Anne Huang. She's a former Deputy Medical Health Officer in Saskatchewan, and she oversaw public health programs in the province for the past 5 years. Dr. Huang, as a medical professional, what really stands out here?
I think what's interesting is the succession of the initial two phase, spaced 2 weeks apart, which is the incubation period of COVID-19. However, that means we're not going to know the impact of the phase 1 opening until we have already opened up some of these business in phase 2. So that represents, I think, a bit of a risk for me.
I know something you've been very concerned about is testing and contact tracing. Do you have any concerns about how we're proceeding forward?
As we've spoke about last night, the province currently is still relying on a passive testing strategy. And so that means people have to do the self-assessment online, be assessed by the family doc, and then be referred to be tested. However, that means people who may become symptomatic but have not yet, or if they are very mildly symptomatic when they do become infected, may not be picked up by these tests. And so that's reflected in about 10% of Saskatchewan's COVID-19 cases having no known exposure history that the public health have been able to identify. These community transmission cases represent risk where they could spread further if we're not careful.
If there are local outbreaks, the Premier and Dr. Shahab says that doesn't necessarily mean we're going to go back to super tight restrictions so long as they can trace the cause. What do you think of that approach?
I think that's really interesting timing because this document obviously was prepared for a few days before its release, as the Premier has said that he has shared it with other provincial premiers. However, as the new stats just got released for Saskatchewan today, we have a growing cluster and outbreak in the far northwest of Saskatchewan. Now, it's important to remember that in the phase 1 opening plan, it includes campground, fishing, and angling. Those activities take place in northern Saskatchewan in the boreal forest. And so how the province is going to manage the growing outbreak in the far northwest area in conjunction with this planned opening will be very interesting to watch. And I hope that they take that into consideration in this plan.
Over the last week, you've been very concerned about what's happening in the north. How do you think that it should be handled?
What we know is that it most likely has some connection with the oil sand work camp outbreak in northern Alberta. And there are a lot of work as well as personal and family connection in northern Saskatchewan and northern Alberta. And so rather than waiting for people to present with symptoms, I do think that it's important, especially in these smaller communities in the north, that the public health officials take an active case finding approach, meaning, if possible, screen everyone in the community, and starting with people who work in essential services, but as well people who may end up being employed for the tourism industry if the plan to reopen the phase 1 on May 4th goes ahead as Premier has announced.
What's your best advice to people as the weather gets nicer and that urge to socialize really does become stronger?
Now, we do have the benefit of having a lot of space in Saskatchewan. So if people can remember to still physical distance in the great outdoors, That'll definitely help keep the risk down. It's important to remember, though, that as the temperature climbs, we will end up probably going back indoors where it's cooler with air conditioning. And so it's important to remember that if you're indoor, that's the same situations and the same risk that applies as in the winter. And so it's important to remember that if you are not able to maintain that 2-meter physical distancing distance, do consider wearing a face mask if you're speaking to people in close quarters, especially if you're speaking to people who may have more vulnerable immune status, elderly or those with medical conditions.
Thank you so much for this, Dr. Huang.
You're welcome.